So here we see a patient with upper deep cervical lymphadenopathy. In 1 minute, we are going to study a very important topic for your recent next or NEETPG examination. A 60-year-old male patient presented to us with these cervical lymph node. Along with he was having nasal obstruction and decreased hearing in his left ear. Now let us proceed what other findings we got. The CT scan was showing a soft tissue mass arising from the lateral wall of nasopharynx. And what else we got? The diagnostic nasal endoscopy. When we did an endoscopy through his nose, we got a bulge in his nasopharynx, which was medial to this tubal elevation. So here you can see opening of the eustachian tube in the lateral wall of the nose, and there is a bulge here that is called tubal elevation. So there was a soft tissue mass which was medial to this tubal elevation, right? So there was a tumor in the vault of nasopharynx like this. So here if you again see, we will see the normal nasopharynx, how it looks like. So here you have this opening of eustachian tube, this is your tubal elevation, and this is your normal nasopharynx. Now if there is any growth which is medial to this elevation like shown here, so here you can see a growth which is there, which is medial to the tubal elevation. So yes, your diagnosis is, everybody, your diagnosis is nasopharyngeal carcinoma. So nasopharyngeal carcinoma is the most common carcinoma of nasopharynx seen in bimodal presentation. That means in the first 15 to 25 years or in second decade like 55 to 60 years. So here our patient was a 60-year-old patient who presented to us with the swelling or cervical lymphadenopathy in his neck. Now coming to this question related to this, what is the commonest presentation of nasopharyngeal carcinoma? So right guys, now you will be able to tell this very important question which was asked in INICET. So let us see, what is the commonest presentation? Unilateral conductive hearing loss? Yes. Is it seen? Nasal obstruction? It might be there. Nasal bleeding might be there. But the most common presentation is your cervical lymphadenopathy, right? Why it is most common? Because usually these nasopharyngeal carcinomas, they present late as metastasis to the neck. What we miss is this small mass which is growing in the back of the nasopharynx. So the diagnosis is when we get a patient having this cervical upper deep cervical lymphadenopathy. So mostly in level 2 and level 5, these nasopharyngeal carcinomas, they metastasize. Important point to know here is the nasopharynx drain into the first node, that the this NPC drain is the retropharyngeal lymph node of Ronvier, but we are not able to see these retropharyngeal lymph node. What we see is these level 2 and level 5 cervical lymph node. Now again a very important question, students, very important question bacha log, is the features of Trotter's triad. So one triad in ENT is seen in nasopharyngeal carcinoma. So features of Trotter's triad in NPC are all except. So this you have to tell me in the comment section. A is unilateral conductive hearing loss, B is unilateral temporoparietal pain, C is unilateral palatal palsy, and D is unilateral facial paralysis. Now tell me which of the following is not a feature of Trotter's triad. Yes, you are right. Write me if you are right or if you are wrong. In both the cases you have to write me what answer you thought for this question. So the answer is unilateral facial nerve paralysis. We don't see unilateral facial nerve paralysis bacha log in this NPC. What we say is we do see unilateral conductive hearing loss. Why? Because this mass will be obstructing or closing the eustachian tube opening, resulting in serous otitis media. So hearing loss here is secondary to the compression of eustachian tube opening, leading to serous otitis media. And what is this unilateral temporoparietal pain? This is due to your mandibular nerve, right? So V3, or what is happening is due to close proximity of sinus morgagni with the foramen ovale, your fifth cranial nerve gets irritated and it causes unilateral temporoparietal pain. And this palatal palsy is due to your compression, or you can say paralysis of the 10th nerve. And which muscle? levator veli palatini. So it is secondary to the involvement of levator veli palatini, but we don't see facial nerve paralysis, right? So we are done with very important topic of nasopharyngeal carcinoma. Having most common presentation is cervical lymphadenopathy. The first draining lymph node is node of Ranvier or retropharyngeal lymph node. Trotter's triad has conductive hearing loss, trigeminal neuralgia, and ipsilateral soft palate paralysis. So to note is it is mostly a unilateral condition. So everything will be seen on the side of tumor. If it is on right side, you will get right-sided conductive hearing loss, right-sided trigeminal neuralgia of fifth cranial nerve, and right-sided soft palatal palsy. So all the thing on one side, right? And one more thing is the treatment is mostly, as this tumor is difficult to remove surgically, the treatment is mainly radiotherapy. So this tumor is very radio sensitive. So if you get this patient in your OPD, refer them for early radiotherapy, and if the tumor is advanced, then we give chemoradiotherapy. So concurrent chemoradiotherapy. So this is also your question. In advanced stages of NPC, we give concurrent chemoradiotherapy, and in initial stages you can give radiotherapy, but surgery is very difficult due to this tumor axis, right? So I hope you all will be reading well, bacha log, and just remember the struggle, the hard work, everything, every work is going to pay you. And ultimately you have to remember that your dreams might not make sense to everybody, but the important thing is they need not to, right? The dreams are yours and you have to make them possible for you. So keep studying, keep growing, and ultimately be happy in your journey. Be happy. Nobody has seen the future. What you have is your present. Your present is going to make your future. So live in present, be happy in present, and ultimately you will be having a bright future. Our wishes are with you, right? So this is Dr. Shivam, and do follow and subscribe to the channel to gain more. Take care, stay happy.
Style. Style is the